Okay, this is Sonia Brown. I'm going to demonstrate enteral tube feeding checkoff. I'm going to use the end of this as my peg tube, and then as my peg tube. Okay, first things first, I will verify the physician's order, what formula or what meds or whatever needs to be administered through the peg tube feeding. Oh my goodness, I'm nervous. Anywho, I'm gonna identify my patient, make sure I have the right patient. I'm gonna check their allergies. I'm gonna make sure it's the right patient, date, time, all of my 6 rights. I will go to the patient's room. I will bring my supplies with me, and what we're doing is formula for the patient, and I'll bring 60 cc's of room temperature water for the flushing. Let them know what I'm going to do. Let them know, ask them about any problems. Do a good GI assessment on the patient, making sure there was no pain, anything like that, nothing's going on. I would also wash my hands, put on clean gloves, and I will bring the feeding and the flush with me. All right, so I will also place the patient in the high Fowler's position so they will not aspirate. Verify the tube placement by using the strip, the pH strip, and then I will also check for gastric residuals using my syringe here. Whereas I would place it here on the end, and I will pull back to see how much is being taken, how much is left in the actual stomach. Hopefully that is under the amount the doctor ordered, or under 250 milliliters, and we would just place that back in. Remove that. Then we will remove our plunger. And place on the end. We'll take our flush, put 30 cc's in there, and let that flow to gravity. Then we will proceed with our formula. Pour that in there and let that flow to gravity. If this was a continuous feeding, we would hook them up to a pump with a flush and program that to instill. Once we finish with our formula, we will flush it again to gravity. Then we'll remove this, replace our caps and stoppers on that. Put away our equipment. This plunger does not get along. There we go. If we were on a continuous feeding, or we would also check those residuals every 4 to 6 hours, or whatever our facility tells us to do. The feeding, with our continuous feeding, the bag and the tubing has to be changed every day, every 24 hours to prevent infection. Or also the site of the G tube and the J tube has to be assessed daily, making sure it's clean, dry, and intact. Once we do all that, then we will document what we fed the patient, how much residuals was there, if there was too much residual, what we did, who do we notify, and the appearance of the site, and our abdominal assessment, if there was any nausea, any bowel sound, what the bowel sounds were, and everything. Then we would put the intake, whatever we put in there, on our eyes and nose sheets. What our residual was, we'll document all that. And that is enteral feeding.